Okay, can you tell me a little bit about the people that you see? Because we've talked about a couple. We're going to present some cases. But can you give me like a before of just the way that people come in,
Okay.
why they come in, their perceptions of themselves, what they want done, and then how that transformation happens?
I've seen everywhere from someone coming in as an emergency like yourself, where it's more of a need to have something done because something's obviously wrong,
Right.
to someone who's referred from a patient of mine who liked some work I've done, and they came in saying, you know, I don't love my smile and I really want to fix this and I don't like this, and then we do a cosmetic evaluation and we try and plan a whole case from there. So it really is from a total stranger coming in to someone who's referred from a good patient.
So from, like, take for instance someone who has lived for a long time with something not
And
right
they've been
with
unhappy with what they have.
Yeah. Like it's not, maybe it is an accident, maybe it's they don't take care of their teeth or whatever that is. But they come in, and what are some of the conversations around, you know, kind of, let's call it building a new smile that you get, or do you go that deep?
The first question is always, what do you like and what don't you like about your smile? And you'd be surprised, people know what beauty is. They know this doesn't look right, and then I'll explain why it doesn't look right.
And so what are some of the things that they say?
Someone will say something obvious, like, I think my teeth are too yellow. They're not bright, they're not white enough.
Right.
And then I'll show them a shade guide showing them all the shades of teeth, even into the bleach shades, and they'll automatically point to the bleach shade. I want that.
But that's not really natural.
But there's natural, and there's natural bleach, and then there's too white. There's
like the halogen light.
You can have very white teeth that look natural. And it depends on your complexion. It depends on how old you are. You know, someone who's 30 years old can have white teeth. Someone who's 90 years old, if they have really white teeth, it might look fake. So,
right. That is something that's a little freaky.
Very yeah,
when you see older people with like really, really white teeth, and you know that they've had some work done. I mean, it's not a bad thing, but it just doesn't look natural.
You know what? Having said that, if the person is 90 years old and they want white teeth and that's what they want, and that makes them happy, then it makes them happy, and then they feel beautiful. So,
but I think this is also going to be an interesting conversation when I talk to Dr. Parashkar about plastic surgery, because there's this sort of like this thing about, there's people who want to look as natural as possible, like a better version of themselves, and there's people who just want to look sort of perfect in this thing that's not natural or even realistic. It's not found in nature. You know what I mean? Okay, so let's go through a few cases so that so everybody can kind of understand what exactly it is, cosmetic dentistry. So let's just talk about that for a second. What's the difference between dentistry and cosmetic dentistry? Because it sounds like it's self-explanatory.
I would say the main difference is that cosmetic dentistry is more of an elective approach to dentistry.
Okay, so it's not...
Whereas someone has a hole in their tooth and they have to fix it.
Okay.
And that's also, in a way, cosmetic, because we have different types of porcelain, we have different types of material we use. But cosmetic is, you know, they're not in any discomfort, nothing is clinically wrong with their teeth, and everything is in healthy, is healthy.
Mainly working order.
Mainly working order. You know, maybe some wear and attrition, but for the most part healthy. And then we can transform what they have into something more cosmetic, and that would be an elective treatment.
And can you go through, like, okay, so everybody knows about veneers because everybody in Hollywood has veneers. How do you feel about that? Like, how do you feel about a whole mouth that's just like schwap? Just personally.
I feel like there's a place for everything, and some people have teeth that no matter if you do braces or bonding, it just won't look right. So if they are motivated and they want to fix their teeth, veneers are a great option.
Okay, I have a question.
Yeah.
What's your personal, like, when you just talk to people, what's your personal preference? Like, do you like, you know, God's teeth, or do you like, you know, your work? You know, like cosmetic. You know what I mean? Like, there's a difference in the look.
Well, I think to be a cosmetic dentist and to have work that is beautiful and that looks natural, that's the thing. It looks natural.
Right.
You know, for the most part.
But you know what I mean? Like when you see a chiclet mouth
Mm-hmm.
versus you just see, let's just go American to English. Because,
Yeah.
like the stars. American, like, stars have, like, the chiclet mouths. They're, like, generally all perfect. But you see, like, European stars that have their natural teeth. They're not quite perfect. They could be straight. They could be white.
I think a natural look is a very nice look. You know, it really depends on the personality of the person.
Okay.
I think that has a lot to do with it.
That was just an interesting question. Because
Yeah.
sometimes people like the chiclet look. Completely.
Some people do.
Is it offensive for me to call it chiclet?
Not at all. I don't think if you looked at any of my cases, you would put them in the category of chiclet
No, he's not
work.
a chiclet manufacturer.
No, but that's because it's the lab I use is
Right.
you know, the ceramist I work with is world class, and we work together, and we don't make chiclet teeth. So.
Okay, so no chiclets here. All right, so the first case that we're going to talk about is the biker.
The biker. It was another emergency case. This patient is a young guy who's a dancer at Juilliard, actually. And he was on a bike, and he fell off his bike, and he hit his face. And he came into the office, and it wasn't pretty. I mean, he busted his mouth. And
Was he traumatized?
he was pretty cool about it, but something had to be done.
Right.
It wasn't an elective cosmetic issue.
Right.
It was he broke teeth, and he had to fix the teeth to make them look like his other teeth.
Right.
So I have some pictures. We have the before
Right.
and afters, and the case took probably about 3 months to finish, because we had to have the temporary had to be just right. He needed some other work with the gum work and some root canal therapy. But in the end,
because of the impact of the. So he had.
But in the end, I think it looks very cosmetic, and when I say cosmetic, I think very natural. I think
Okay.
It's very natural.
All right. Okay. And so the second one is.
The second case is a patient who was referred from a very good patient, and he came in as a consult saying, I don't like the way my teeth look. I want nicer teeth. I've had bonding. They've stained. They don't look nice. And I want to know what I can do.
Okay.
So for him, we ended up doing 6 veneers on his front
So
teeth.
top and bottom, or just top?
Just top.
Okay.
And we basically replaced the old bonding, which is a type of, I would say, a plastic type material that stains over time. And we were able to make him nice porcelain teeth that look very natural and is very happy with.
So obviously you see him come in and he's like, I want my teeth fixed. So when he leaves, because you see him again,
Mm-hmm.
and what's the difference in just his demeanor and the way his comportment, or is there?
Smiles a lot more.
Real,
He
yeah.
smiles a lot more, and when you smile more, you just have you give a better vibe
Yeah.
off. And people comment on his smile all the time. He could not be happier.
And that must be amazing for a person who
Was
never,
ashamed of his
right,
smile,
ashamed of that.
and
They
then
never
going from
get
ashamed
right.
to someone
right.
saying, "Wow, you have a great smile."
It's like someone who loses a lot of weight and people are like, oh my God, you have a great
Mm-hmm.
body. It's like something you never would expect to hear associated with
Mhm.
yourself. Okay, so, and the last case is,
The last case.
I like this one a lot.
You like this one.
I
The
do.
last case is a patient who came in just not happy with the way her smile was. She was congenitally missing or not born with teeth. She wore a flipper or fake removable teeth for years, her whole life.
You might know flippers because of like Honey Boo Boo.
Yeah.
Because the flippers are what the children, what do you call them, pageant kids,
Exactly.
put in their mouths when they lose
But
their front
this is
teeth.
a successful lawyer who was wearing flippers on her top and bottom arches.
Right.
And she was living her life and not happy. And she was scared of the dentist. She didn't want to pay for the treatment. She wasn't motivated. And all of a sudden she had an epiphany that, you know what, I don't want to live my life like this
Right.
anymore. And she wanted to fix her teeth. So what we did was we took her out of the partials and we put her we restored her mouth with implants and veneers.
And so when you do an implant, because you have to drill into the bone to
Mm-hmm.
set for the implant, do you get a temporary when you do that as well?
for her case, what we did was she was missing one of her front teeth. So
I can relate.
We placed we placed an implant and we made her an immediate temporary. And I can show you the pictures. From
Okay.
And then for the back teeth, we placed the implant and she still wore her flipper.
Okay.
But we cut the front tooth off.
Okay.
So the advantage for that for us is that we can shape the gum tissue. She has a front tooth when she takes the flipper off. It was a very, very big impact that she had just from that first procedure that we did.
And how long did that process take?
The process from start to finish took around 5 months with her.
And you saw like maybe once a month or twice.
We saw her once or twice a month for follow-ups and for treatment, and it was, you know, she was very motivated. Once she was understood everything and felt comfortable seeing me, and she actually enjoyed coming in. She really, every time she came in, she was excited.
I'm sure, because every time she came out, her mouth was better.
Exactly.
And so, did you notice a difference in her personality and her personal projection each time that she came in? So by the time that her mouth was finished?
Absolutely. The last day when she walked out and she didn't have to wear the flipper at all. I mean, it was like a different person walked out of the room. Because it's you know, like you leave like your old baggage and your old stuff behind, and she walked out and she was like a new person.
But when that bonding snapped off, I was like thrown back into that place of like, oh my God, like this was just not going to happen, and it needed to be repaired, and it needed to be done quickly, because like other people would have found it funny. Not, you know what I mean? Like there's times where you go like, wow, my mouth is jacked up. I'm just going to get it fixed and it'll be fine. But for me, it goes into a whole like sort of emotional thing.
Absolutely.
That was really profound. So the idea that this is in my mouth now and that it's beautiful and that I may not have to worry about it ever. But I can always come back. It's transformative. So I just want to thank you for taking the time, one, to fix my mouth, but also two, to talk with me and my viewers, because I think it is important. I know that teeth are more than just cosmetic. We have to take care of them, floss, all that stuff, right?
That's correct.
But also, I think that it is important that if that's an issue for you, that you go and check it out.
In order to be a healthy person, you have to have a healthy mouth and healthy teeth. Because people neglect the dentist and they don't like going and getting cleanings, but a lot of the same bacteria is in our mouth, that's in our whole body, and you know they've done studies where someone who has gum disease, the same bacteria can go into your heart.
Yes.
So there's no reason not to be on a regular recall and have your checkups done and just...
But you should shop around for a dentist too, because I feel like I felt very comfortable with you. Like I trusted you. Yeah. I mean, he's young. I call him Dookie Howser. But I felt very comfortable, and I thought that your chairside manner was...
Bedside manner.
Well, it's not bedside. It's chairside. But I think it's important that people shop around for a dentist. That's kind of hard because you feel so vulnerable going to the dentist. What do you suggest?
I find that for the most part, my best patients or my most compliant patients are patients that are referred from existing patients. People that are happy with me and happy with my office and the environment that they come into to have their dental health, taken care of.
And can you tell? Like I talk a lot, but you should talk to your dentist. I mean, not when he's working in your mouth, but you should communicate with your dentist. You should feel comfortable communicating with your dentist. What your issues are, what your anxieties are. Absolutely. Because a lot of times people shut down, and that's why I think we have a bad experience.
Absolutely.
You see, it's good information here. All right, so thank you, Dr. Winokur. Every time you see me, he lives with me now. Not really, but...
I'm married to her front tooth.
Oh, yes. And hopefully we'll never get a divorce.